Healthcare access is a big problem for a lot of Americans, and mobile health clinics are vehicles that deliver healthcare to underserved populations. So it's not surprising that during the COVID-19 pandemic, they were used primarily for infectious disease screening and vaccine delivery.
So during the pandemic, those who were experiencing vulnerabilities were the most likely to die or be hospitalized from the virus. And so certainly South Carolina is a very rural state. We're a relatively poor state, and so we see more of those disparities here.
Our goal is to develop a statewide network for outbreak detection, forecasting, and coordinating emergency response. We are doing this through strategic data collection and integration, model development, collaboration with health partners, and software development. This will allow us to track outbreaks, identify high-risk communities, and coordinate emergency response so it ultimately saves lives.
Health equity is an essential building block to creating prosperous, resilient, and healthy communities. And we can't ever reach health equity if we can't provide, high-quality health care to our rural populations. So really, this modeling toolkit is giving us an opportunity to really identify those high-risk populations and truly meet the need of our South Carolinians.
So our toolkit can identify outbreaks in each community for a variety of infectious diseases and forecast where those outbreaks are going. Additionally, it maps what resources are available so that we can better allocate health interventions, including mobile health clinics, to high-risk areas of greatest need.
I think the big difference between what we're seeing now with this predictive modeling is we have such better coordinated data. And that's a game changer for you to be able to make a decision. And I think the transparency back to community as well about how we're making decisions. And that's really important because that transparency that we can have back to our community about how we're making decisions is going to build trust.
So we're in the early implementation phase of actually using Lior's modeling toolkit. But what we're doing is identifying high-risk areas based on the map that shows us all the data that he's incorporating, and then going out to these sites to provide free screening for COVID, flu, and RSV in order to identify infections early, prevent hospitalizations, and prevent preventable deaths from these diseases.
But I think also just to treat other epidemics that we're seeing. I mean, we have an opioid epidemic in this country, and sadly in South Carolina, there are other infectious diseases that will be there. Being ready for the next natural disaster. I mean, our part of the country was hit hard by Hurricane Helene. Mobile health centers and mobile health clinics can help really be an answer to that. And so to have a coordinated way that we're taking care out into the community, regardless of what our public health emergency is going to be helpful.
And thanks to the work we have been doing here, we can now send mobile health clinics out to high-risk communities in a more effective way and ultimately save more lives.